Hi, my name is Ricardo Cahigas. I'm going to be doing my abdominal assessment today on my patient. What we're going to be doing, I'm just going to be lifting your shirt up a little bit and just revealing your abdomen, okay? What we're going to basically do is just reveal the abdomen, and we're going to be looking at the respiratory effort of the patient that the patient is doing. We're going to look at the rise and fall of the patient's breathing. Also going to be looking for any pulsations for the aorta, and also for any peristalsis or movement of the abdomen for digestion. After we do a visual inspection, we're going to do auscultation. We're going to break the abdomen up into 4 quadrants. Obviously the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. What we want to be listening for during the course of auscultation. I'm going to use, I don't have a diaphragm on this particular stethoscope, but pretend we would have a diaphragm and we would be listening in all 4 quadrants. So what basically we would do is listen for, again, for peristalsis in all 4 quadrants. It should be like a tickling sound. And you should hear it approximately 4 to 30 times a minute in each listen for a full minute in each one of the quadrants if you have to. But again, the movement of peristalsis should be 5 to 30 times per minute. And again, you will listen to use the diaphragm and you will use the bell. And then you will also listen over like the diaphragmatic region. This is for the aorta, and again for the pulsation of the aorta. Once you were done with auscultation, excuse me, let me just go back a little bit. You would also, once you were listening for the aorta, you would listen to some of the other arteries also. You listen to where the artery breaks off into the iliac arteries and renal arteries. And also you will feel for the femoral arteries and listen for the femoral arteries also on both sides, again with the diaphragm and the bell. And again, what you're checking for, just any regular arterial movement or bruise in that area that could indicate restrictions in the blood flow. And you could listen to the aorta or the iliac arteries and renal arteries on both sides, and it breaks down into the femoral arteries too. After you were done with that, you would begin the assessment with the percussion. And again, the abdominal region should really be tympanic. Just try to relax your abdomen a little bit. You know, whatever it's initially when you're being touched to get it goes out, but just try to relax a little bit. Just going to be listening for, and again, it should be relatively tympanic. Tony's a slim guy, so, and again, it should be tympanic or hyperresonance. Again, in the right upper quadrant, we're going to be checking just his liver. And again, what we do is go along the mid-clavicular line. And we start trying to map out the borders of the liver. And again, you go from tympany until like a little bit of a dull sound. There it is, a little difference. Again, you want to try to stay between the ribs and try to map it out. And it's hard to hear. You can listen to when it gets a little dull. And again, when you do a visual map, actually it should be between 2 to 7 centimeters to the mapping of the liver. And again, you would do the same thing on the other side for the spleen. You go along the mid-axillary line. And again, when you look at your patient history and physical initially prior to meeting the patient, you'll find out what type of medical history they had. I know that this particular patient has this history of sickle cell disease, so I probably would be checking the spleen a little more thoroughly than I probably normally would. Again, the palpation of the spleen, you want to make sure, unlike the liver, you can actually easily feel, check the tympany of the borders when you percuss. There you go. This sounds dull. And again, if you count up for the ribs, from the 12th rib, you hear like a dull sound. What do you do for it? Just take a deep breath. And it goes again. And what you want to just relax your breathing. So when the patient is breathing, actually doing the percussion, what you should feel, you should feel it goes from tympany, from dull sound to timpani. You feel that because the spleen is moving up and down. You shouldn't feel the normal spleen. You shouldn't be able to feel the spleen below the. It's protected behind the rib cage on this side, so you should be able to feel it. One of the things you also want to auscultate, which I forgot to mention too when you're auscultating for the sounds, you want to auscultate over the liver. Again, both the diaphragm and the bell. And also over the area of the spleen, just make sure that this spleen, again, you're checking for just regular arterial movement in that area. Sorry, I just lost my train of thought. So again, we just did that. We're going to just go into from percussion to palpation. And again, we're going to feel, when we're doing the palpation, it's going to go to deep palpation on the right upper lower quadrant. You're going to feel for the predominantly the ribs, for the liver. And again, this can be done by several techniques. You feel the borderline. So you take a deep breath. And again, you'll feel it go up, breathe up naturally. And you should feel the liver as you're mapping it out. You can actually feel it as it moves and hits the bottom, the margin hits the bottom of your hand. Another technique that you use is, again, this is Tony's rib here, and slightly go underneath your rib. Tony, take a deep breath. Let it go down. Up again. Breathe out. And what you can feel the actual liver hit the borders of your fingers as you're holding it here. And again, deep palpation. On this side, again, you should not feel the liver on this side. Okay. Right lower quadrant, this area where the appendix is. And again, you'll be looking for any pain or discomfort while your palpation here. And when you're doing the deep palpation on this side, it should be intestine and colon. That could be actually a little bit uncomfortable for the patient, but again, it shouldn't be painful. And again, as you're palpating here, you should be feeling for iliac arteries, radial arteries, and femoral arteries to also just be able to feel for it. Some of the tests that you could do to try to rule out actual some of the organs that are in this particular area, the right upper quadrant, is the liver as well as the gallbladder. So we're going to do look out for what's called a Murphy sign. And again, what you're going to do is do deep palpation. Take a deep breath. And the gallbladder is located right behind the liver. I'm going to push in and push out. Take a deep breath, Tony, in and out. Again. And as I'm doing the deep palpation, if the patient had, again, a positive Murphy sign would be, if the patient had a cessation of breathing, because it was painful for them to take a deep breath as I'm palpating in that area, it would be a sign of cholecystectomy, inflammation of the gallbladder. Another technique you use, another sign we look for, looking at the McBurney's point, and what you'll be looking at the ASIS joint here, which basically for the hip, and also the umbilicus, and 2/3 of the way down is where his appendix should be located, here in this location. So again, what I'm going to be doing is I found pressing on the McBurney's point, and again, normally the patient would have, looking at the history and physical, usually would have some type of signs, symptoms, maybe fever, abdominal pain, discomfort, nausea, vomiting, and then also if you were doing palpation in this area, at the McBurney's point, they should have pain and discomfort there too. Again, one of the other signs you could check for is the Rothstein sign. Basically on this, if I were to palpate on the opposite side, and then I let go, and the patient would have rebound tenderness or tenderness on this side. Again, you can also check for rebound tenderness on this side. I would say, is it more painful when I press in or when I press out? And again, that would be the rebound tenderness that would indicate some inflammation in the perineum in this area that could indicate a possible inflammation of the appendix. Some of the other signs that you would have the patient do, you can have the patient push against your hand. Just push against my hand. Just lift your leg up. And what you're going to do is just push up against my hand. And you just try to push it down. And again, the patient, while they're moving and pushing up, if they have any pain or discomfort at the McBurney's point, will probably indicate signs and symptoms of possible irritation in that area or inflammation of the appendix. Again, Tony. Again, if you had any type of inflammation within the peritoneal cavity, when you ask them to exert himself and muscles in this area would actually indicate, as they're moving the muscles in this area and exerting some pressure in that area, they will experience some pain and discomfort as they're moving it. Just want to make sure I cover everything. Again, that's called the iliosol sign. We would do the obturator sign, which basically would have the patient just rotate their knees. And what you're going to do is just bend your knees, and then you're going to rotate your knees towards me. And again, during that process of rotating the knees, you just rotate back, rotate the knees. If they had any pain or discomfort, depending on where they have it, indicate signs of appendicitis, if they have it on McBurney's point, or just with general pain and inflammation in that particular area. Again, because the movement is focused within the abdominal cavity. Again, one of the things that we're going to review or go over, one of the other tests, specialized tests we're going to do, is we're going to check for ascites. And again, obviously Tony has a flat abdomen, and you will see a lot of times, I've seen during the course of my career, where you see patients, usually you see patients that suffer from renal insufficiency, kidney failure, liver failure, or have any type of hepatic dysfunction. You will see that those patients will develop ascites or fluid within the peritoneal cavity. Some of the tests that you could do, or you could check for, is that what you would do is obviously you could do, pretending that Tony's abdomen was slightly oval, extended. What you could do is just use percussion. And again, you would hear timpani at the top of the area of the abdomen. And then as it was gotten lower, and you would doing percussion sounds, you would actually, it would get a little duller because you have fluid that collected lower down. What I would also ask the patient to do is just rotate it on your side, Tony, just on your side. And again, what would happen is that the fluid would go down to a lower level, and again, you could do the same thing. You would have the timpani at the top, and you have the donuts at the bottom. One of the things you would have the patient do, and again, if they have an extended or large abdomen, is that basically would have them as almost like a blade. You're doing a karate chop. You would have them actually, or have another staff member or nurse hold the abdomen right in the middle of the patient, or preferably another staff member. But again, just to stabilize the abdomen a little bit, what you would do is what's called a wave test, where you would just pitch the abdomen or slowly, very quickly, push the fluid on one side, and you actually feel it and feel for the hand or the wave that hits the abdominal cavity on the opposite side. And again, that would be one of the checks that you would have for ascites. I think I covered all the signs. Again, do you have any questions at all? Again, getting back to just, I'm going to make sure that I covered it again. Normally, you would not feel a spleen; it would be absent during the course of your assessment. And again, you will be checking. You can listen for auscultate for the liver and the spleen in those areas. Just to listen for any unusual sounds in those areas, abnormal sounds, and also for just where the margins normally would be. Again, on the spleen, you normally would not find it, and you would find it on the right-hand side with the liver. That concludes my abdominal assessment. Thank you.